40-year-old Annette White Best, a nurse at the Percy Junior Hospital, is the most recent healthcare worker to die from COVID-19 complications. According to well-placed sources, she was not vaccinated. At the forefront of the COVID battle are nurses and doctors, so it was no surprise when they were given priority when the government first rolled out its vaccination program. President of the Medical Association of Jamaica, Dr. Andrew Manning, says the vaccination take-up rate has been very high among medical doctors.
It's hard to give an exact figure, but the doctors generally have taken up the vaccine in some of the public hospitals that have been able to get information on. Over 90% of the doctors. And from our internal polling, certainly close to 2/3 of the doctors. And we don't have complete figures. There's really no complete database that would give us an exact number.
As for nurses,
a survey was done early this year before the vaccine came. At that point in time, about 30% of our nurses showed a willingness to be vaccinated. We did education sessions, there were sensitization sessions, and I do know that that number went up to about 60 to 70%. In talking with the nurses, I know that nurses are taking their vaccine. There are still those who have not yet done it yet, but I do know that nurses are taking the vaccine.
As for the rest of them, the Ministry of Health says it's a concern.
Some of them are of the view that they are exposed sufficient to build the immunity that is required because they're on the front line each day, and there is some science there that may support that. Others may just not feel that they need to take it because they have the expertise, they take the precaution. Our advice, obviously, is that these are not the most effective way to secure yourself against the COVID virus.
Dr. Tufton says the ministry can only use moral suasion to encourage the unvaccinated healthcare workers.
It does send a negative signal, particularly in a country where we have hesitancy. But again, it's not mandatory. It's a decision that they have to take. I do hope that the risk that is involved in the exposure levels that they encounter each day, they'll be encouraged to take it, and that has been the message that we have been sending to them.
Shamela Pullen, TVJ News.